There are some rapid updates coming out about general practice, including the new stuff about the vaccinations, as well as the potential sale of the largest practice in the UK. Myself and Andy are going to cover this really briefly for you as we tech enhance your primary care and learning. GP learners, and welcome to this quick update episode that we've got that's about a couple of rapid changes that have happened in general practice. Two we didn't really see coming, to be honest, as well, isn't it, Andy?
Yeah, I really like these update episodes. It's good to respond to events as they happen. And as we're recording this on the 30th of August, two interesting stories are broken. So I think we're going to be looking at new details that have emerged in a letter to general practice and providers about arrangements for COVID and flu vaccinations in the autumn-winter period. And then there's also that story about Centene exiting the UK primary care market, which we'll get to after we have a look at the vaccination stuff, I guess, Gandhi.
Yeah, so shall we get started with the vaccination thing? So just to remind people that back at the beginning of August, we had the letter that came up about general practice itself and the vaccination schemes, and there was a lot of, I think, questions around how it would work effectively and whether COVID vaccinations were financially viable for many places. There seems to be less uptake. There's now been this additional letter that's just come out today with some significant changes in it that may potentially change how networks look at doing the COVID vaccinations in particular. Do you want to start us off there, Andy?
Yeah. So, well, first of all, Gandhi, I was just going to, ask you to remind us what some of the controversy was around the initial plans for vaccination, because I believe we were going to be asked to delay flu vaccine, for example, until we started the COVID vaccination, which was felt to perhaps not be the best way of approaching things. So, do you want to just remind us a little bit about that,
Sure.
Gandhi?
So the initial thing was that they felt that the peak of the issues with flu and COVID was probably going to be a little bit later. So for that reason, they wanted to delay the flu vaccinations themselves. And then that caused controversy and issues because obviously many clinics had already started planning and booked patients in, and they were told that they weren't potentially going to be paid for delivering those vaccinations in September. That got adjusted shortly afterwards. As NHS England kind of changed their mind about that and said that actually it's completely sensible. People got those booked in. It may not be what we like, but actually we're still going to make sure that you get paid. The other thing was the reduction in the payment for the COVID vaccination. So I think it went down to £7 something or other for a COVID vaccination for a routine patient. And then there was an additional £10 payment made for those patients in care home residencies and stuff like that. And I guess the reason that was a big issue is that's considerably less than what practices were paid in previous years. It's less than what they were getting for the flu vaccinations. And there was a question about the financial viability. Very much a push to co-administrate, but the logistical challenges of co-administrating are much more significant and timely. So therefore, there's a question of whether many places would be able to manage that. That's all changed as of today.
Yeah, so it's interesting. So I guess the letter is sort of confirming the eligibility criteria, and there are some changes around timescales, and there are some changes around payment. And I suppose it looks like the motivation for this is that the government is concerned about new variant emergence and some vaccine escape, and they really seem to want to get the skates on in terms of getting jabs in arms. To get the population ready for the winter, I suppose. Gandhi, I haven't quite picked up from this letter. Is there a new vaccine developed for the campaign this winter? You might not know the answer either.
I'm afraid I don't know the answer to that either. So we don't know whether this changes the vaccine type. I believe it's meant to be the similar vaccines that we've done on previous shots and stuff. So, but similarly.
It was just those mentions of vaccine escape and things like that, and new mutations that just made me wonder if you knew if there was a new vaccine that had been delivered. I suppose what we've seen previously is that multiple doses and boosters does still confer improved resistance to disease severity, transmission, and contracting these illnesses. So I guess they're carrying on with the same strategy. So shall we scroll through? I guess the first new information is around, well, around timings and the focus on timings. So we've
Yep.
got those on the screen. Gandhi, do you want to take us through it?
Yes, so effectively they want to start the vaccinations from the 11th of September, which is a lot earlier than originally planned, with the focus on, in particular, care home residents vaccinated by the 22nd of October. So there's an actual, ongoing deadline for them to be vaccinated by. They're going to open up the early bookings for local areas to book those high-risk patients that are not care home residents from the 11th of September. And then the following week, we'll open the national booking line that allows anybody to book in to have their COVID vaccinations from the 18th of September. And basically, those are the timing changes that they've made, which has basically brought things forward by about 3 weeks, I think, effectively.
Yeah, absolutely. And then they just talk about the eligibility criteria, which I don't think have changed from the previous announcements, but
No, not that I can tell either. It seems to be fairly similar. So residents and care homes for older adults, all adults aged 65 and over, persons aged 6 months to 64, and clinical at risk groups based on the Green Book, frontline healthcare workers, persons aged 12 to 64 who are household contacts of somebody who are immunosuppressed, and then persons aged 16 to 64 who are carers, as defined as the Green Book as well. So that's the document that we all look at when it comes to vaccinations and things.
and those working in a caring role.
Yes.
So those working in care homes for older adults as well. So those are the criteria, and then the financial support. So I think this has changed a little bit, Gandhi. And do you want to lead us through those changes?
So they're suggesting there's going to be an additional £10 payment for vaccinating those patients who are in care homes. So originally there was meant to be an additional £10 payment. So I think this now takes the total up to £20 if you vaccinate a patient who's in a care home, but you have to have it done by the 22nd of October. That's the key thing for the additional payment. Then there's an additional payment of £200 per completed care home by, again, Sunday, the 22nd of October. So if you get everybody in the care home done, you get an extra £200 for the practice for doing that additional work and vaccinating those patients. And then for the other cohort, so
And
all the other, for all the mobile patients, normal kind of non-care home resident patients and stuff, there's £5 additional payment, taking it up to what would probably be about £12 something or other, which I think was the original payment amount a couple of years ago. So taking it back up to those previous levels. And again, there is a deadline of the 31st of October, I believe, on that one.
yeah, so so they're throwing well, there's a little bit of extra money going into getting these things done early. So there's obviously some concern about the impact that this new variant will have on people, and I suppose also just on general pressures within the NHS, over the
Yep.
course of the winter. So I guess they have their reasons, and this feels sensible. Do you think this will have much impact on your network, Gandhi, or your plans locally?
I think the challenge of this is that obviously there's a timeline for this to start within about 11 days or so from the time that we're recording this episode. So I think for those network areas that weren't planning on doing it, to turn around a service based on those financial figures, whether that's possible or not, would be interesting. And there's also the question about supply. So it does mention about how some supply aspects will work, and then it also talks about the booking line being open. For practices that are interested in doing this, you have till the 4th of September to inform NHS England to do so. So if you do want to sign up to this, you have basically 5 days if you're listening to this when we published it.
Yeah, really short turnaround, isn't it?
Yeah.
Again, always the way with this, and you're right, Gandhi. If you didn't already have a plan for the delivery of this, it's unlikely. Whilst this might motivate you to produce a plan over a longer time scale, it's unlikely you'll be able to pull that together within 5 days. So it's difficult, isn't it?
I think potentially the payments to vaccinate the care home residents may be manageable and doable for most people. That potentially would
Yeah.
facilitate that. I think it's the mass vaccination of the other cohorts that's going to be the more challenging one to achieve, unless you've already started down that path. I think there may be some places that might manage it, but it is a significant challenge to get this all in place if you haven't already got started and stuff. I know I'll be asking my network tomorrow in our board meeting whether or not this is something they want to look at. I'm not sure how they'll take it, but obviously we will wait and see what they decide in terms of whether this is manageable and feasible. But the interesting thing is they're putting some funds behind this. So it raises the question, what do they know that we don't know as well?
That's what I was thinking. That they're obviously concerned, and they do want to get as many jabs in arms as they can in those eligible patients, and they want to do it quickly. So So it's interesting, isn't it? But
It
I
is.
don't think there's too much concern being expressed more widely
Hmm.
through general channels to the public. But let's see. Yeah, they say vaccine supply vaccine supply is not a constraint for this campaign, and providers will automatically have supply replenished. So I wonder if they are using stocks of vaccine that was previously purchased and has been on ice.
Maybe.
But we
We
will
shall
see.
see. So we've
Mm.
covered the stuff about the vaccinations. Let us know down in the comments below what you think about this. Is this something that would change how you would approach if your practice or network looking to deliver the vaccinations and stuff? If you're somebody who has no idea what we're talking about and just come across us, let us know what you think. That'd be really useful. Because we're now going to talk about something that's completely different to vaccinations, but something that was a massive news story about 2 years ago, and it's now evolved into another massive news story today, isn't it, Andy?
Yeah, well, just breaking today. So Pulse, ever the friend of
Mm-hmm.
EGP Learning podcast, are reporting on a story that broke in the Financial Times today. So if we just remember back, not last year, but in 2021,
Yeah.
80 medics, which were at the time the largest group practice in the country. I think they had
Mm-hmm.
53 GP surgeries in the London area, was acquired by Operos Health, which are a UK-based subsidiary of Centene, which are a large healthcare provider and insurance company in the United States. And that was
Yep.
quite controversial.
Mm-hmm.
It created the largest, well, it was already the largest group practice in England, in the United Kingdom, and that was taken into private ownership. So that ruffled a few feathers and created, a lot of
Mm-hmm.
discussion at the time, and we discussed it. And just for information, Centene also owned Circle Health. We have a Circle Health treatment centre in Nottingham, for example. So they own private hospitals and treatment centres around the country. I think they had about 53 sites. So those were that was all owned by
Mm-hmm.
Centene, this large American company. So that's set the scene. The story that's broken is that Centene are now looking to sell their UK GP practices.
Mm-hmm.
So they ended up with 60 practices covering 640,000 patients, the largest sort of single provider of GP services in the UK. Was under foreign ownership and is now they're looking to sell that. Earlier in the year, they agreed the sale of their UK private hospitals and clinics, Circle Health, to a Middle Eastern company to buy it for 1.2 billion. And the GP practices are up for sale, and they say they expect to get around 51.2 million pounds for it. But
Mm.
it's unclear who they intend to sell to and who will buy. But they are exiting the UK market.
Mm-hmm.
Completely by the look of things. I think they still do some sort of data analytics and other support work. Whether they'll
Mm-hmm.
continue doing that for ICBs and NHS trusts, I'm not quite sure. But in terms of healthcare delivery, they're exiting. And I guess this comes on the back of other companies, looking to exit the UK market. So Babylon Health acquired some GP practices over the
Yep.
last few years, and they have been finding it difficult to run those practices and are looking to leave as well. I think they may have divested themselves of those practices as well, or at least are in the process of looking to do that. So it's interesting to see
Yep.
large private companies divesting themselves of UK provider health provider arms, including primary care. Yeah. What were your
Mm-hmm.
reactions to this, Gandhi?
Well, definitely an interesting story. The largest group practice in the whole of the UK now looking to exit the market, which is, I think a really interesting story to be noted of. I think it speaks to what many people have been saying potentially around the whole concept of how the monetization of general practice isn't what people think it is. Bigger is not always necessarily better. It can be, but I think it has to be done correctly. I think there's also the question of who's going to be the purchaser. I think many people are looking to see what that might mean to, is it a new entrant to the market? Is it potentially looking at breaking up existing practice structures and that kind of stuff? Who knows? We will find out. But it's an interesting story nonetheless, because particularly we're in a market whereby, if a large multinational company is struggling to maintain cost effectiveness of delivering primary care, what does that say about smaller units and the issues that practices are potentially facing to keep themselves afloat? And does that mean we need a new contract?
Well, we'll get one next year. Just depends on what it looks like, I guess.
Well, we may or may not. We don't know. We are hearing about there potentially being a holding contract in place for another year, pending what looks like likely elections next year as well. But I think it speaks to some of those things, and it'd be really interesting, I think, for people to know what's going on. It seemed like the Centene, the Operos model was looking at how some of that works with some of the wider aspects. So linking up with Circle Health, the potential options of people going for private healthcare, feeding into that and stuff. And has that worked? Has that not worked? Well, it seems like maybe it hasn't. I don't know. What were you thinking, Andy?
Yeah, it's really, really interesting, isn't it? I guess what Centene and Operos, what it appeared they were going for was sort of a, vertically integrated model, and looking for economies
Possibly.
of scale. So, with vertical integration, that's where you sort of control different parts of the value chain of a system. So I think they were looking at controlling general practice. That might refer into Circle Healthcare. And then doing data analytics and supporting ICBs. And I guess they felt that they might have a mutually supported business model there. Doesn't look like they've found that it works, I guess, given that they're exiting the market. The other interesting thing is I think it may demonstrate that economies of scale don't apply as well to primary care or healthcare as they do in other sectors. I mean, when you get down to it, I guess what healthcare is you can try and move away from this using technology and other methods, but it's a fairly highly paid healthcare profession. A doctor or a nurse or a pharmacist sat pretty much needs to be one-on-one, either on the telephone or face-to-face or on video, but either way it's kind of one-on-one, real-time clinician time with a patient, and it's quite difficult to scale that. You can look at getting some efficiencies in the back office, I guess, but when it comes to it, the patients are having contact with healthcare professionals, and maybe that doesn't scale very well. Other businesses that don't necessarily always scale well, things like hairdressers, things like that, they're often still delivered by very small teams, and delivered very well. And maybe actually healthcare and general practice in particular is more like a hairdresser's than it is like a Tesco's, in terms of what you're actually doing. It's a high value service. So it's interesting. So they've not made the economies of scale work, it would appear. And I do actually wonder about, we've got friends who work, in the ICB locally. And if a large number of practices in your area are now looking to be sold or looking for a new buyer, you're going to have another problem that you didn't have before, to think about. So, it's going to create some instability for ICBs and of course for patients as well.
Absolutely.
It's worrying, isn't it? If you don't know who's going to own your GP surgery, or if it's going to be there, or if it's going to be taken over by somebody else and who that is. So that's worrying. And, I guess just the scale and the size of this just magnifies that problem for the system. If a small little GP practice, goes down, it's a problem, but it's just one of a large number of smaller organizations, whereas if a big one goes down, it's more of a systemic problem. So I just find it, I think it's a really fascinating story. It'll be interesting to see how it pans out and who the new owners are.
Yep. And you may think it's an interesting story, and we are going to cover this in a little bit more detail in our upcoming episode that's probably coming up around about here if it's already released. If not, you can come and join us next week to watch that episode in a bit more detail as myself and Andy talk about the complexities, a little bit more about private healthcare and the challenges it sometimes faces in these kind of situations. Alternatively, you can watch our other episode that talks about private healthcare and the guidance about how that should work in general practice coming up right here. And as always, we're here to help tech enhance your primary care and learning, and we'll catch you in those episodes. Speak to you soon.